Shirley, how are you?
Hi, good evening. Alhamdulillah, all good. Thank you.
Good evening, good evening. How are you?
Alhamdulillah, everything is fine.
Good.
How's
Let us start the class. As far as your task is concerned, you can take as much time as you will require. And while compiling, if you need any kind of guidance, you can easily leave a text to Ms. Kenza. Okay.
yes, yes,
So,
yes, I will. I'm just trying to find you out now. Some because there are tasks the regarding for there the task the hardest thing is to the for interviewing.
okay, okay. So you
Yeah,
are.
that's the most because it's not allowed, it's invading the privacy, so especially if the cases I will pass is morely for expat as local, less local, or morely for the local expat are less in the hospital field.
Okay.
So
If
that's the
if
only thing, that's the concern that I have.
Okay,
um
if you think so that their privacy has been invaded or they are not willing to provide you with proper answers or they are unable
mm-mm.
to answer all of the questions of your questionnaire, then you can just assume their answers or you can just
Ah,
assume that if you were at their place, then how you would
okay.
give these answers, okay?
Okay.
So,
Yeah.
it is.
But the other option, sorry, the other option that I was been thinking is because I have some those who are working in the hospital, like for the administrative.
Mhm.
So one from the insurance. That was the other option, that at least I could get points from them for some cases that I'm going to tackle.
No, it's not a problem if it is not feasible for you to take their interviews. And of course, you will assume the answers. Okay, you can become
Mm.
the host and the guest as well at the same time.
Ah. Oh, that's really
This will.
good. Good help. Mm.
Okay,
Thank
so
you.
welcome. So
Thank you.
let's start from where we where
Yeah.
we left in lecture number 3. Okay, so lecture number 4 was related to task. So the context was related to context. We have completed 3 lectures, 1, 2, and 3. Okay, so today is lecture number 4,
Mm.
and it is about understanding the implications of legislative frameworks in the chosen health and social care area. So, first of all, okay, I'll explain you what is legislative and what is meant by implications of legislative frameworks in chosen health and care area. Okay, health and social care area. And as you know that I have chosen a child health care area. Recapitulations. Okay, in previous lecture, that is, I'm talking about lecture number 3 here. We discussed about types of hospital in US. So actually, we discussed about the types of hospitals in US in lecture number 2. What is the
Yeah.
organizational structure of a hospital? Roles and functions. So lecture number 2 and 3 were about all these points. Now, what are the keywords of today or main objective of today's class? Impact of legal framework on chosen healthcare system and evaluation of the legislative frameworks. Okay, so before proceeding further, let us analyze that what is meant by legislative framework, or you may say what is meant by the legal framework. So the word legislative is being driven from the word legal. Okay, so it means law, something that is related to law. And implication of legislative framework in specific health and social care area means how the legal laws, how the laws of that country will be uh, implicated or will be applied on specific healthcare areas. Okay, why it is important to apply the legal laws of any country on almost every institution of that country. Legislative framework. Legislative framework or legal frameworks mean both the instruments of law and the institutions responsible for putting them into effect are essential to advance the universal health coverage UHC and achieve the health and sustainable development goals. Okay, so now to kind two terminologies have been used in this definition. So you can say this is formal definition or authentic definition of legislative framework. Legislative framework means legal or a framework, or you can say framework of laws, instruments of laws, and the institutions. Means the necessity of implementation of laws and the rules of the institutions. Okay, the laws and the rules of institutions that are responsible for putting them into effect. What? Putting them, which thing into effect? The progress of any institution, or you can say the success of any institution. It is very important. The implementation of laws, whether they are by the government, they are by the country, or the rules of the institution, both of these things are very important for the slow or consistent progress of any institution. Okay, they are essential to advance universal health coverage and achieve health and sustainable development goals. Okay, so now the two things, not only the progress of the institution, but the laws of the country and the rules of the institution, they are also very important in order to advance the universal health coverage. How the health will be maintained universally and achieve the health and sustainable development goals, and how the health should be achieved, the health standards should be achieved along with the developmental goals or development goals. Now the word sustainable is used, it means at the least level. If we are not taking our hospital, our daycare area in the race or competition of success, then the minimum standard should be at sustainable level. Our institution should be present on the sustainable level. Law has played a key role in many great public health achievements. For example, vaccination programs, motor vehicle safety, reducing smoking, the control of infectious diseases, food and pharmaceutical safety. So these are, you can say, a few examples. Okay, a few public health achievements or public health phenomena, okay, in which implementation of law is very very important. For example, vaccination programs. Okay, there are proper rules, or you can say laws, related to what should be the prescribed age for administration of a vaccination, at which age and weight the vaccination should be given to the children or the adult. Motor vehicle safety, or you can say the traffic rules. Okay, if we talk about the traffic again, the laws have been implemented by every country. Almost similar laws have been implemented by the countries, all countries. Now related to smoking, a bundle, numerous laws have been present or stated by the government in almost every country. The control of infectious diseases. Whenever there is pandemic or endemic, the country will, in either case, devise some laws or action plans in order to reduce the spread of that contagious disease. Food and pharmaceutical safety. So, food and pharmaceutical safety. Pharmaceutical means something that is related to the manufacturing of medicines, manufacturing of drugs. So, for manufacturing of drugs, for the manufacturing of food, both preparation of food, both of the phenomena involve the implementation of important laws set up by the country. Enabling legislation. Okay, and how now this was all about why the rules are important, why the laws are important, why they should be implemented in any country. Okay, now how will we enable the legislation? How will we implement the laws? Agencies are established by legislation. First of all, you should know that there should be a committee present in every country, present in the government, that will be responsible. The member of that committee will be responsible for the implementation of laws throughout the country. Okay. Now, this committee will establish the agencies. As agencies are established by the legislation, these agencies establishes the structure and mission as well as the budget. Okay, now these agencies will do two things. These agencies will establish the structure and the mission structure of another group of people who will be going to implement the laws on provincial or federal level. And mission, what will be their aim? Next is they will also, these agencies will also decide the budget. So of course, for the implementation of laws on various institutions in the country, throughout the country, there should be a healthier budget present. Okay, because of course traveling will be involved. There should be some sort of connections or communication things like phones and letters. They will also be involved, and many other things along with these basic necessities are present, and for that of course budget is required. Can be detailed or broad. Now the agencies can be detailed or broad. Detailed means a long chain of people, a long chain of designations will be present within the agencies. For example, any agency has been established on the federal level, then that agency is further subdivided into the provincial level agencies. Now, again, the provincial level agencies are further subdivided into the agencies that will work in different cities or a pair of cities. Okay, so they will be, these agencies will be detailed or broad. Broad means a number of agencies that will only work on federal level. Then comes the number of agencies that will only work on provincial level, means both of these agencies will not be interrelated with each other. But the agencies that will be working on provincial level or the federal level will be interrelated with each other, means similar nature agencies will be interrelated with each other. Now, what will they do? They will protect the public health, cheap electric power and plenty of it, contrast with the ADA. Okay, now the basic aim of these agencies will be protection of the public health. Of course, the main thing, the main aim, or you can say the main goal, provision of the cheap electric power to the people present, or you can say to the persons, individuals present in the health and care institutions, and they will make sure that plenty of the electric power will be provided to all these institutions that will be related to health. Contrast with the ADA. Now they will carry out their functions and they will compare the working of these agencies with ADA. Now let us see what is meant by ADA. Okay, ADA, Americans with Disabilities Act. Okay, so it is an act, it is a law. So while implementation of law on in any country by agencies of the legislation, the final step of the procedure, the complete process is the comparison of that law with ADA, Americans with Disabilities Act of 1990. It was the most, you can say, proper act related to the disabled person present in America at that time. And now it has been set as a standard for all the health related laws. Agency is limited by the legislation and the state and the US constitutions. Okay. So agency is limited by the legislation committee, because the legislation committee is the one that has created the agency, and the state, of course, the country, and the US constitutions. Here we have written the US constitutions, but if we talk about the other countries, then in that case, again, the agency will be limited by the legislation committee, the state, the country, and the constitution of the country. Because constitution of any country is the most important thing while running that country, or while you can say governing that country. Okay, so constitution of that country will limit the agency. However, countries often struggle to develop, implement, and evaluate effective legal frameworks to improve the public health. So, of course, every country will try its best. The agency of legislation of every country will try its best to implement, to develop, prepare, implement, and evaluate the most proper, or you can say the effective laws in order to improve the public health. While each country differs, there are many shared challenges and opportunities to use legal frameworks more effectively to drive health and development. Okay, so there may be some sort of differences between the legal frameworks of all the countries, but there are some basic things. There are some common things that have been shared by all the countries almost. So let us see what are these things? What are these shared common things? So, the basic thing that is similar among all the countries is the main strategy. And what is the main strategy? The main strategy is what can be done, how to do it, and who will be involved. This strategy is similar among all the countries when we talk about the implementation of laws on health and social care areas in order to improve the public health. So, what is our agenda? What is our aim? In how to improve the public health. Okay. So, this is the main strategy. What can be done? What steps can be taken to improve the public health? How to do it? What will be the procedure? What will be the phenomena to do this thing, to achieve this thing? Who will be involved? And who are the persons, the agencies, the committees that will be involved in carrying out the whole procedure. So let us see. So this picture actually demonstrate the main strategy. What can be done? Governance, rights, social determinants of health, public health risk, service delivery. These are the few action areas that need to be improved in order to improve the public health. We will explain all these one by one in coming slides. How to do it? How will we improve the given action areas? Identification and development, implementation and enforcement, monitoring and evaluation, drafting, getting a decisions. This should be our action plan in order to improve certain areas. Okay, and these are our action plan along with the challenges that we will face while improving our action areas. Then third point is who is involved, who, which agencies, which persons, which designations will be involved in improving the action areas, in improving the public health. Policymakers, parliamentarians, civil society and communities, service providers, and regulators. Okay, so these are the designations or the capacities that will be involved in improving the action areas present in the first circle while having the barriers along with the action plans present in the second cycle. So let us see them one by one. The first step of our main strategy is action areas. What can be done? Okay, action areas include enhance the health system governance and leadership. Okay, so if we see the first action area is governance, so we will enhance, we will improve the health system governance and leadership. The health system governance is the governing authority of any country, governing authority of health sector of any country. Okay, so we will improve that governing authority. If some individuals working on a prominent designation of health system, they need to be replaced, then we will of course replace them. And if the leadership need to be replaced, of course the government of that country will replace the leadership. The parliament of that country will replace the leadership, because we are intended to improve the public health, and the present governance is not performing their work efficiently. So it means that there is a need, or there is a time to replace the present governance. Next is respect, protect, and fulfill the right to health. We should know that how to protect the health laws, how to fulfill the necessities that are required for protection of health of common people. We should know them. It means that proper knowledge should be provided to all the people who are carrying out this responsibility. Improve access to affordable, safe, and quality health services. It means we need to improve, we need to extend our government sector hospitals, government sector healthcare areas, because only government sector institutions are accessible to all the individuals of that community, to all the individuals of that country. Why they are accessible to every person present in that country? Because they are affordable, they are safe, the government is responsible for each and everything, and quality health services are also provided in many of the government institutions as well. Because when you make someone responsible for doing something, only in that case the quality can be assured. And usually it is not, this thing is not assured by the private hospitals. Prevent and manage the public health risk. So while we are working to improve the health of common people, public health, then along with assuring the health of common people, we need to take into account the risks, the hurdles, or the barriers that should be present in our way. So we should be mentally ready, or you can say we should have mentally prepared that how we will tackle these risks, or how we will manage these risks. Foster multi-sectorial collaboration to address the social determinants of health. Okay, multi-sectorial collaboration means different institutions, health institutions, different hospitals, different daycare areas, they will from various sectors will collaborate with each other in order to make it sure, in order to make it possible that the health of common people, the health of common public will be improved. The priorities for strengthening the legal frameworks across a wide range of potential action areas will be different from country to country. Actions should be informed by available evidence and knowledge, consistent with international obligations, integrated with non legislative strategies, responsive to the needs of the country, and feasible within its capacities. Okay, now the priorities, or you can say the basic action plan that should be adopted by every country, or different countries, they may be different from each other. Okay, however, the main things, the main considerations that should be adopted by every country include the sufficient knowledge, include consistency with the international obligations, means international laws should be abided by the country, the agencies, integrated with non-legislative strategies. Okay, non-legislative strategies should not be taken into account, responsive to the needs of the country. Of course, the requirement of the country, requirement of the people of that country should be taken into account, and feasible within the capacities. And not only we have to take into account the requirements, not only we have to implement or compare with the international obligations, but above all, we should also consider this thing that feasibility is very important. It is not that we will just develop the laws, and those laws will be very difficult to implement in the country. Okay, feasibility should be uh, also considered while implementing the laws, while developing the laws. They should be easy enough to get implemented in all the institutions, health institutions. Countries should consider actions to enhance the health system governance and respect, protect, and fulfill the right to health, particularly for most vulnerable, improve access to affordable, safe, and quality health services, prevent and manage the public health risk, and foster multi-sectorial collaborations to address the social determinants of health. While implementing or while developing the laws, okay, the laws that should be implemented in healthcare areas, every country should consider the basic things. Now, the basic thing involves that they should have the sufficient knowledge related to healthcare areas and healthcare implementation. Their law that they are going to develop, it should be um, consistent to the international obligations, international rules and regulations. Okay, because every country, the laws of every country has further some standard laws uh, in uh,
Mm-hmm.
in compare or in contrast to which they have to formulate their laws. Then non legislative strategies should not be included in these laws, and the requirement, or you can say the necessities of the citizens of that country, should be taken into account. And the last and the most important thing is that law should be feasible enough, easy enough to be implemented in all healthcare institutions. Okay, we should not make a law that is very awesome, very up to the mark, but it is very difficult to implement. So we should also consider the feasibility of implementation. Now the countries should consider those action plans, those laws that are required to improve the health of common public. Okay, and, because this is the main
Mm-hmm.
agenda or main aim of that law that we are going to develop. Okay, so and that law should be according to the 5 points, these 5 action areas that we have just discussed. Means it should include the enhancement or improvement of the governance and leadership, and the respect, protection, and fulfillment of the right to health should be included. The law should be prepared in the light of affordability, safety, and quality of health services. And then there should be some points related to the management of public health risk. And last is, of course, multi-sectorial collaboration is another very important thing that should be taken into account while developing that law. So these are few action areas that should be given importance, that should be highlighted while developing the health and safety laws. Okay. Now the next point in the main strategy is how to do it. Now we have discussed that these are the action areas and we need to improve these and these action areas. How will we do it? We will the process include analyze the problems and identify the viable options. Okay, just as I told you that if the agency has observed that governance or the leadership of the governance need to be replaced, so they will replace the governance. So the problem was the governance leadership, the person who are owning that governance, the leaders of the governance. So how we will solve that problem? We will replace the leadership. Okay, so the first point of the process is analyze the problem and identify the viable option. Next is overcome the obstacles and get to a decision. Okay, you have to sort out what are the barriers, what are the risks present during the process, and how we can reach to the results. Design the law, implement the law, monitor and evaluate the legal framework. So these are the 5 steps, only 5 steps that is involved in developing and implementation of the laws. First, we will sort out what is the problem. Then, and along with this, we will identify how we will solve that problem. Second is we will also analyze what are the barriers or the risk present during the process, and we will finally get to the decision, means we will solve the problem. Third is we will design the law, means we will develop the law, then we will implement the law, and finally we will start monitoring and evaluating the legal framework. Okay, so after implementation of the law, it is very important to monitor that law, evaluate that law, whether the law is working in correspondence with our hopes, okay, or not, or does the law need to be improved more. Okay, so it is very important to evaluate the law or legal framework. Countries will have different priorities for improving the various processes to strengthen legal frameworks for health. Processes should address the full cycle of legal development, including the problem analysis, evidence evaluation, stakeholder engagement, drafting, implementation, and evaluation. Each of these processes can occur together or serially and is affected by the technical, political, and other factors. Careful mapping and navigation are essential in successfully strengthening the legal framework. Okay, so the above 5 points have been explained over here again, and it is stated that countries may have different priorities for improving the various phenomena, various procedures in order to strengthen their legal frameworks, in order to strengthen their laws for health. Okay, however, the common procedure in order to strengthen their legal laws for health include analysis of the problem, identification of the problem, all analyzing the obstacles or barriers, then evaluation or getting to the result, then designing the law, implementation, and finally the audit or the monitoring of the law. So all of these processes, they may occur together or they may occur one by one. So now this thing is usually determined by the technical problems or technical things required. Sometimes political agencies are also involved if they become barrier during the process. So that is why the process has been delayed. And there may be other factors. Sometimes even environmental factors also play very important role in delaying of the formation of any law. So, careful mapping and navigation, careful steps need to be taken while developing and implementing the law. Okay, so now last is who is involved, mean the capacities that will be involved. Yes, please.
That's okay.
Okay, so last is the capacities, the designations, agencies, organizations, or the people who are involved in doing all these things in these areas. Okay, so let us see, build the capacity of policy makers, build the capacity of regulators, engage parliamentarians, empower and ensure the participation of communities, coordinate with health providers. So policymakers, regulators, parliamentarians, communities, and the healthcare providers or the physicians, all of them are involved in developing the laws and implementation of the laws in various healthcare areas. Okay. Now, again, the countries will have different priorities for enhancing the capacities of various stakeholders involved in strengthening the legal frameworks for health. Policymakers and regulators, they are essential players in developing and implementing the laws for health. The first two persons, policymakers, of course, these are the one who are preparing the policy. They are by name involved in preparing or developing the laws or the policies. And the regulators are those people who play their role, who play their part in a regulation, or you can say in speeding up the process of developing of laws. So both of them are directly involved in strengthening the legal framework of health. Policymakers, um, parliamentarians are critical with their parts to enact the law, approve the budgets, and provide oversight. Okay, first two are involved in development and regulation of the law. Parliamentarians are involved in approving the budgets and providing the oversight. Means they will overview the law. Is there any flaw present in the law, or the law is perfect one to be implemented? The integral role of health providers and communities demand a transdisciplinary approaches to public health law, which can help break down disciplinary, cultural, and resource barriers. Okay, so the communities, policymakers, and regulators are directly involved in developing the laws and regulating the laws, while the parliamentarians, they are involved in approving the budgets and providing the oversight. They, you can say, they are recheckers, while the health providers and the communities, they are directly involved because they are directly affected by the health laws, so they are directly involved in um facing the results of the implementation of that law. Okay, so they are directly involved, therefore their uh, manipulation, or you can say the evaluation of the laws, directly involve the communities and the healthcare providers. Increasing linkage between the law and the health. Legal frameworks are an important tool for organizing and managing the health systems. They codify and allocate the responsibilities, foster the cooperation and coordination, set the standards, and authorize or constrain action. The law can be used to shape markets, for example, for instance, by banning the dangerous product or mandating the government procurement practices that give the incentives to producers to make healthier products. Passing a law can also be a good way to convey information, to alert people to particular health risks, and to influence social norms and behaviors. Okay, so laws are very important thing in order to, if we talk about the organizing or managing the health system, because anything can be managed only in the presence of rules. If you have some rules, if you have some laws, that you will arrange your things. For example, if we take a lay example, everyday example of arranging our closet, and of course we have some
Mhm.
rules, we have some important things in our mind that we will arrange our dresses in one side, our shoes at one side, and clutches in one side. So same is the case with organizing or management of health system. Okay, so laws are very important in managing these systems, or you can say the healthcare areas, because by implementation of the rules, responsibilities are uh, allocated to the physicians, to the nurses, the paramedical staff, the administration staff. Okay, so everyone will get to know about their responsibilities only when some sort of rule has been implemented, law has been implemented in a hospital or daycare area. Foster the cooperation and coordination. Of course, that law will motivate, or you can say, will make sure that there should be coordination among the workers in that hospital, or there should be cooperation among the workers in that hospital. The law will set the standard and authorize the or constrain the action. Okay, so after implementation of law, of course, everything will come to its own place, original place. Everyone will be responsible for their duties, and everything will, you can say, the whole framework of the hospital will be organized after implementation of the law. The law can be used to shape the markets, for instance, by banning the dangerous products or mandating. Yes, also, not only hospital, the implementation of health laws is very important in the field of, in terms of market health, pharmaceutical markets, you can say, the markets that are that will involve the medical stores or the pharmacies. Okay, for example, if any product, any medicine is dangerous, or it has been banned because of the dangerous active ingredient present in that medicine, then of course law will make the government the law will force the government to ban the product as soon as possible. Okay, its production will be banned, its transfer, of course, its transfer will be banned again, distribution, especially distribution, will be banned. Passing a law can be a good way to convey information, to alert people to particular health risk, and to influence the social norms and behaviors. As we have seen this in the times of COVID-19, certain rules, certain laws were created by the countries, and specifically by WHO, World Health Organization, and all of these laws were implemented in the countries separately, in contrast to the standards set by WHO. Okay, so when there was peak of COVID, so alert was sent by WHO to all the country affected countries. Okay, so we have seen a live example of this thing in 2019, 20, and 21. Legislative framework in children adult healthcare area. Policies and programs that improve the health outcomes. Relevant policies include legislative and administrative actions that affect the public health, child care, and early education, child welfare, early intervention, family economic stability, community development, housing, environmental protection, and primary health care. Okay, so what is the role of legislative framework in children or adult healthcare area, or if we specifically say child healthcare area? The policies and the programs will be prepared or developed that will improve the healthcare outcomes. Then the policies will be prepared that will include the legal actions that will affect the public health, affect the health of the children. Child care and early education, of course, along with the care of child or children child patient, their early education will be an important part of that law. Child welfare, early intervention, family economic stability, community development, housing, environmental protection, and primary health care. It means that every aspect, everything that is very important in the life of a child, from his education to his safety to his family economic stability, his environmental protection, everything will be included in the specific law that is implemented in child health care area. Evaluation of the legal framework. Okay, now after the implementation of the law comes the evaluation of legal framework. Regulation of law in child adult healthcare area, codes of practice, and standards in child adult healthcare area. So the basic three things will be evaluated. Three things of the law will be evaluated. How the law was implemented and regulated in the child healthcare area, what are the codes of practice in child healthcare area, and the standards. Okay, the standards should be according to the standards as given by ADA and WHO. The codes of practice should be present in contrast to the codes of practice as given by WHO and ADA. And similarly, the regulation or development of the law will be in accordance with WHO and ADA, because we have set these two things as our standard. So, of course, everything will go or will be conducted in accordance to the standard. Okay. Now, the regulation of law in children adult healthcare area. Policies and procedures are important. Regulation of law in children and adult healthcare area. Policies and procedures are important in education and care of young people because they are a legal requirement in the National Quality Framework, identify and minimize the risks, and establish the service as a professional and effective organization. Okay, so how the law related to the child healthcare area will be regulated? So, policies and procedures. Basically, these are also the laws, kind of laws, you can say. They are very important in education and care of the young people. Why are they important? Because they are legal requirement. They identify and minimize the risk, and they establish the service as a professional and effective organization. Okay, so as we have discussed it earlier, the policies and procedures are legal requirement. They are required in our every phase of our life, whether it is related to health, whether it is related to business, whether it is related to any everyday, or you can say the common practices that are present in our life. Health laws are used to formalize the commitment to goals, such as the goal of universal health coverage, creating a drive for action. To enable the cooperation and achieve health goals, people use law to create different organizations, such as hospitals, and relationships, such as contracts for providing health services. Public health law and public health policy are fundamental tools that assist states in the task of protecting the people from threats to health, preventing disease, and striving for healthy population. Okay, regulation of health law in child healthcare area is very important. Okay, why? Because they are prepared in order, um, you can say, in with the concept of commitment to goal, with the concept of achieving the goal or aim, and the aim is to improve the health of common people, to improve the kids present generally in our hospital or any healthcare area. Okay, so cooperation and coordination among the workers in that hospital is another thing that should be present in order to achieve the aim. Public health laws and public health policies, they are the two basic things. Health law and health policies. You can say policy are those things that work on lower levels, small scale, while health law is something that has been implemented on the complete uh, health system. Okay, you can say that health policy is implemented or present in the hospitals or daycare areas, while the health law is present on the all will be implemented on all the hospitals or daycare areas of any country. So it is a bigger thing as compared to policy, and they are very important in order to alert the people regarding some disease, in order to prevent the disease, or in order to take the precautions and enable the people to come back to their healthier life after fighting with certain diseases. The five existing health related laws are, okay, now because we are talking about the legal frameworks or the laws again and again, so we should know that there are five health laws that are present currently. These include universal health care, syntax, reproductive health, national health insurance law, and graphic health warnings acts or laws. So, inshallah, we will discuss all these laws one by one in our coming class, or if and maybe we will be able to discuss some other laws in addition to these laws as well. Okay, so this was all about today's class. If you have any question, you can ask me.
So far, it's okay.
Okay, good. Okay, so see you in the next class, inshallah. And while in upcoming complete,
Inch.
while compiling your task, if you face any difficulty, you may ask. Okay.
I will. I will.
Okay. Take care of yourself. Allah Hafiz. Goodbye.
You. Thank you so much. Have a good night.
Good night. Thank you. Goodbye.